Hey everyone, this is Dr. Chad Kuntz, and today it's exciting. We're going to talk about, is a herniated disc normal? And in fact, not just there, we're going to cover other quote-unquote abnormal findings on the lumbar spine, and we're going to correlate that with those who are healthy, they're pain-free, and they're doing just fine. So shout out to, again, Adam Meekins. He's a sports physio. He's created an amazing infographic. This is his content. I'm just using it because I think it does a great job of visually displaying the commonalities of abnormalities in your lumbar spine. So you can see down here, we're discussing the 20-year-olds, all right? And then we go to 40s, 60s, and 80s. For some of you who didn't spend all their life covering these topics such as disc degeneration or disc bulge, I want to kind of go through with that a little bit using the anatomy model we've got here. So just to kind of cover our bases, if it's a disc bulge, or excuse me, disc degeneration, let's just start there. And we talked about this in the neck, but the same holds true in the lower lumbar spine. You know, just to kind of give you guys an understanding, most discs, or all discs, are about 70% water, all right? And we'll just kind of use that to cover the height of this disc. We'll call that, I don't know, 3 millimeters. I don't know off the top of my head, but we'll call that 3 millimeters. Disc degeneration just means that it becomes desiccated, or it kind of becomes dried out and becomes somewhat flattened, and it loses height. So let's just say over here is the one that's flattened, and let's just call that 2 millimeters. That's the idea with disc degeneration. It's actually quite a natural occurrence, and it doesn't have a high prevalence at all with pain. So as we go back to our chart, we go back, here we go. So disc degeneration, it's in blue. So if you're in your 20s, it looks interpreting on this graph, somewhere around 35% of people will have disc degeneration and they're pain-free. Right? So if you're in your 40s, all of a sudden it's almost up to 75%, guys. 75% of people, if you're in your 40s, if you're pain-free, you'll have a disc degeneration. Do you see how profound that is? And look, in the lower lumbar spine, it is literally universal. It is literally universal by the time you're in the 80s. Yet, does everyone in their 80s have low back pain? No. So we're going to kind of progress into what a disc bulge is and discuss that. So you can kind of think of a disc bulge or herniated disc as this disc kind of moving backwards into kind of the intervertebral foramen. In fact, there's kind of a protective layer here at the end of the disc that kind of gets broken, kind of like there's a hole in the dam, so to speak, and that water kind of starts to go out of the traditional disc, and it kind of slides backwards into the intervertebral foramen. So that would be kind of the next categorization from a lower lumbar spine perspective. All right, so as we again look into the 20s, about 30% of people have that. At our 40s, I mean, we could stop there. Literally half the people have a disc bulge and they're still pain-free. All right, disc protrusion would really kind of just be the next level. You can kind of think of it like this. Think about it if toothpaste got out of your container. It would be kind of hard to put the toothpaste back in, and that's kind of what I use the analogy when I tell my clients a disc protrusion is. Just kind of a smaller, this is more the herniated disc, and a smaller pocket kind of slides out. So it's a little bit more of a, we'll call it deterioration or next level problem in the lower lumbar spine. Yet still, if we go back to our chart, this is in pain-free individuals. So if we go back into the 60s, nearly 50% of people, we'll call it 40% of people, they still are pain-free. And there's a couple other diagnoses here that you may not be familiar that I wanted to talk about. So facet degeneration, because sometimes you'll see that on an MRI. So facets are kind of the meetings here between the two bones. So let me paint you a good picture here. So it would be kind of the meetings right in here. Those would be your facets. It's quite common, as we'll see in a second, to have your facets even degeneration, because you can see there's only a small piece of cartilage that sits in between there. Otherwise, they're connected, and those can be a source of pain in the lower lumbar spine. Yet, when we go back to our chart, let's just jump right to our 60-year-olds. We're looking at, around 50% of people again, that are they're healthy subjects, they're pain-free, yet on the MRI it shows, or CT, that they have degeneration. And then the last topic, spondylolisthesis. So there's a couple of terminologies floating around there. Spondylolysis would be a fracture in the pars interarticularis area back here, but we're not talking about that. We're talking about slippage. So sometimes you might hear it where they'll say maybe they'll even say your joints aren't of a line. I guess that's technically true, but you'll have one joint that's slipped forwards or backwards. Okay, so you can either have that joint go too far forwards, or the more common one of the two is an anterolisthesis, where the joint is literally sliding forwards, and that's graded upon the percentage of slippage that is in contact, which sounds really quite nasty, right? But if we go back, we'll say in the 60s, now even though it's a lesser number, still around 25% of people would have some form of a spondylolisthesis, and they're pain-free. You can see though, however, with an increased language and definition of a pathological proposed problem, there's still quite a majority of people that are pain-free. So this might leave you scratching your head, well, what's actually going on? Well, that's why it's really important to find a movement specialist, to see how you're moving, to see your past history, to see and find any other details that might be causing that pain, because it's hard for me to put validity in a pathoanatomical diagnosis with a static image on an MRI or CT image when you are a neurodynamic evolutionary animal. You're a biological animal. I mean, there's so much more that goes on than just a static image. Again, that's why it's important to see how are you moving, what the strength looks like around the spine. And to be honest with you, that's why I've become much more kind of musculoskeletally curious about the back, opposed to just solely relying on an MRI or CAT scan. As always, I hope that was helpful. Thank you guys so much for your time.